Your heart is a muscle roughly the size of your fist, and it squeezes roughly 100,000 times a day. It does this without taking a single break over the course of your entire life. With all that effort, the muscle is hungry. But there is a counterintuitive fact about how the heart gets its energy. It cannot feed itself from the massive volume of blood rushing through its internal chambers. Instead, it relies entirely on a private, external network of delivery vessels draped across its surface. These are the coronary arteries, and they wrap around the top of the organ like a crown, feeding fresh oxygen to every inch of the working tissue. Because this vital organ depends completely on a tiny external supply line, the margin for error is zero. Cut off the flow through these surface tubes, even for a brief moment, and the muscle underneath begins to starve immediately. To see how that supply gets cut off, we have to look closely at the inside wall of the artery. Over years, and sometimes decades, fatty materials, cholesterol, and cellular debris quietly collect just beneath the smooth inner lining of the vessel. Most people picture a heart attack as a pipe slowly clogging shut with massive hardened deposits, but that is largely a myth. Often, the large calcified blockages have grown tough shells. The deadly threat is usually a modest, small, hidden deposit beneath a flimsy membrane. Doctors call this a vulnerable plaque. It is a soft pocket with a massive, greasy core, held back from the bloodstream by a fibrous cap measuring less than 65 micrometers across. That protective layer is thinner than a single strand of human hair. Inside that plaque, an invisible cellular battle is raging. Immune cells called macrophages move into the greasy core and actively release enzymes. Those enzymes chew right through the collagen fibers that give the cap its strength, fraying it strand by strand from the inside out. Add to this the mechanical stakes of your relentless pulse. With every single heartbeat, a wave of high-pressure blood flexes and pounds against this microscopically thin, deteriorating wall. This decades-long process turns a microscopic section of your artery into a biological time bomb. It holds together against the pressure for years until the structural integrity of the cap reaches its absolute limit. The question is no longer if it will break, but exactly when. The countdown begins the moment the fragile cap tears open. When breached, the plaque's greasy core is suddenly exposed to the fast-flowing blood. Your blood has a built-in emergency response for breaches like this. It senses the tear and immediately sends cell fragments called platelets to stick to the surface, acting exactly as they would if you had just cut your finger. Deep inside the plaque is a protein called tissue factor, the most potent clot-triggering substance in the area. When the blood hits it, the chemical trigger kicks the clotting machinery into high gear, causing platelets to pile up in a massive cascade. Because this is happening inside a narrow, vital artery, the rapid clotting is catastrophic. The mass swells in seconds until it completely stops all blood flow, wedging itself into the vessel like a cork jammed into a pipe. This catastrophe is caused by a perfectly executed repair. The same biological system that saves you from a cut finger is now suffocating the heart, triggered in the worst possible location. Downstream from that blockage, the heart cells are still working, but no new oxygen is arriving. Within seconds, the starving cells frantically switch to an emergency backup mode to generate energy. It barely works, and it floods the local tissue with toxic acid. This severe plumbing failure is the strict definition of a heart attack. The artery is blocked, the muscle is dying, but the victim is typically awake, breathing, and experiencing intense pain as the tissue starves. If that damaged, starving muscle suddenly short-circuits the heart's internal electrical rhythm, the pumping completely stops. The victim immediately collapses and stops breathing. That is a cardiac arrest. Conflating these two distinct crises can cost vital seconds in an emergency. Recognizing whether you are dealing with a conscious plumbing problem or an unconscious electrical failure dictates the exact kind of emergency help you need to call for. Once the blood stops, the muscle does not die instantly. The cellular death starts deep inside the innermost layer of the tissue, furthest from any available backup supply, and slowly spreads outward over several hours like a stain soaking through cloth. Surrounding that dead core is the border zone. These starving cells are still alive and can be saved if blood returns. This shrinking zone is why doctors race a 90-minute window to physically open the artery or inject clot-dissolving drugs. On the outside, your body translates this internal cellular starvation into a desperate alarm. The classic sign is a heavy, crushing weight or pressure right in the center of the chest, lasting for more than 10 minutes. But the most dangerous heart attacks are the ones that stay quiet. Some victims, especially women and older adults, experience atypical signs. They might feel profound fatigue, an unexplainable clammy sweat, or a sudden upset stomach instead of crushing pain. Brushing off these softer alarms is the deadliest mistake a person can make. Every minute spent sitting on the couch waiting to see if you feel better is a permanent, irreversible surrender of your heart muscle. Adult heart muscle never grows back. Once border zone cells expire, the body replaces that dead tissue with a stiff, non-beating scar. That rigid patch permanently weakens the heart's overall pumping power for the rest of your life. Long after the event, the blood carries a chemical confession of what happened. When heart cells die, their membranes break open, spilling a securely locked protein called troponin into the bloodstream. Those troponin levels peak and linger in the blood for days. By running a simple blood draw, doctors can chemically confirm exactly how much tissue is starved, even if the attack happened quietly days prior. A heart attack feels like a sudden bolt of lightning, but it is actually the finale of a play that has been running for decades. Mastering this timeline gives us the chance to see the signals early enough to save the heart that can still be saved.